There are going to be some massive changes coming for Medicare Advantage in 2026. And what is happening is Medicare Advantage is going through what is called SARs. SARs are service area reductions, which means they shut down a plan in a particular area. And these SARs are going to affect between 1.5 and 2 million people. So up to 2 million people are literally going to lose their Medicare Advantage plan going into 2026, effective January 1st. So this is a major deal that's coming along with Medicare Advantage, and certainly one of the reasons that I stay away from Medicare Advantage. We just have no control with it. They can do what they want when they want. So they are restricting networks, they are shifting providers, and they are creating these SARs, these service area reductions. So just like everything else recently, costs have been going up, and Medicare Advantage is really way over the tip of their skis, where they are just giving away benefits that are not even healthcare related, whether they had grocery cards or subsidies back to Part B premiums, things that cost significant amount of money that the government really has been subsidizing. It's pretty ridiculous right now that a member that joins a Medicare Advantage plan costs the government more than a member that stays with original Medicare. The whole idea of Medicare Advantage coming along was to save money. And now we've set a position where we pay more for somebody to join a Medicare Advantage plan. So Medicare Advantage plans a lot of times have no premiums, and people think they're free. Well, they're not free. The government pays upwards of $1,000 per member per month for people that join. So we pay for them to join, and then they're supposed to manage the care. And it's a for-profit environment. So these Medicare Advantage plans are private insurance carriers running a for-profit model. The less they spend on you, the more they make. And that is the wrong model within a healthcare system. And now it's really coming home. And what's going to happen this year is there's going to be a drastic change. So where these SARs are happening is primarily with PPO plans, the preferred provider organization plans, which gives people the ability to go out of network. Even though it's more expensive, it gives the ability to go out of network. So the majority of these SARs, they are getting rid of those plans. And why? Because it gives you too much freedom to choose your doctor and your hospital, and it costs them more when you do it. So they are pulling back and going back to the basic HMO model, the Health Maintenance Organization. Anybody familiar with HMOs back to the old movie days where it's just extremely restrictive, causes you to have to get a referral from a primary to go to a specialist. They have pre-authorizations. They make you jump through all sorts of hoops, and they have very limited networks of doctors and hospitals. Very likely the doctor you want to go see is not in the network that you're allowed to go see. Again, a very bad model for a healthcare system that I would want if I'm going to be needing significant healthcare, and we all will, as we get older, need this type of healthcare. So we want freedom and flexibility. That's still with original Medicare. And with a supplement, very little out-of-pocket costs. Why people choose to go into Medicare Advantage is really beyond me. The primary reason they talk about is the premium cost for a Medicare supplement plan, which generally is about $100 a month. So that would not restrict me certainly from choosing to stay where I have provider choice and hospital choice, and pretty much anything's covered that's medically necessary. Nobody is making decisions on whether or not they want to pay for it. So it's just a pretty simple decision for me. But with this SARS scenario coming up, so what's going to happen? You're going to get a letter that's going to be your annual notice of change, and it may say very clearly canceled on your letter. Your plan has gone away, which means you have to do something. You can choose another Medicare Advantage plan, possibly face the same scenario going forward. And I feel for people that are in the middle of care, especially if you're in the middle of significant care. If you've had a chronic condition, you've got relationships with doctors and hospitals and everything in between, and all of a sudden it just blows up and you can no longer go to those same doctors or that same hospital, you have to find and start over again. It's absolutely ridiculous that Medicare allows this to happen, for one, but that they almost promote it, and they might even be promoting it more. And again, it boggles my mind on why we would do this when it costs more for them to send somebody into a Medicare Advantage plan than to keep them on Original Medicare. Original Medicare is one of the few government programs that runs really, really well, and it's cost effective, and it just keeps you happy, the doctor happy, the hospital happy. It works, and why we want to mess with it, I don't know. But now we're seeing what can happen with Medicare Advantage, where when they pull the plug, you're stuck with having to figure out what to do. Now, on the slightly positive side, you can come back to Original Medicare. You can get a Medicare supplement plan. You would be in a guaranteed issue position. So if you're in an unhealthy situation, you can still get a Medicare supplement plan without medical questions, but your options are limited because it's guaranteed issue. So you will have very specific, likely a plan G, unless you were born before 2020. If you're turned 65 before 2020, it'll be plan F. And that's not a great choice because it's very expensive to have. So options are limited. Or you can choose to find another Medicare Advantage plan and go into that other Medicare, but you're going to have to do it yourself. They will not automatically enroll you into a new plan, which, again, maybe they should find something very similar to what you had and enroll, but you may not want that either. So you probably want the choice, but now you're going to have to do it all over again, where you did this years ago, had to figure stuff out. Now you have to figure it out again. So just beware of this. It's coming. Look for your annual notice of change letter. And a lot of this is in rural areas. So if you're in big city, probably not going to affect you. But if you're outside a big city, make sure you look, because if you get a service area reduction, your plan is going away. It's going to be effective on January 1st, no matter what. So come this Medicare open enrollment period, we have to look and figure out and make sure we know what we're doing. We're happy to help with this. I don't sell Medicare Advantage. I don't want to sell Medicare Advantage. I do Original Medicare with Medicare supplements. Everybody I deal with is super happy. We don't have SARs. We don't have reductions. We don't really mess people over. And that's exactly where I want to be with my healthcare. We're happy to help. Visit my website, MedicareOnVideo.com. We'll send you an email with a quote for the lowest, best price supplement in your zip code. Makes it easy to understand exactly what costs might be. And then if you want to come back to Original Medicare, we're happy to help. We'll make sure everything gets put in the right place. Make sure you don't have to deal with this stuff down the road. So I hope you found this helpful. Have a fantastic day.